So today we're going to start by really zooming out when it comes to mental health. Rather than looking at an individual and how this relates to one exercise physiologist, we're going to look at the global influence of mental health conditions and how exercise and exercise physiologists can play a role in solving this global problem. But we will actually look through the lens of an individual client. So let's start by talking about a client. Let's call him James. So James pretty constantly feels worthless. He finds that no matter what he puts his mind to, he doesn't feel like he can succeed. And as a result, he's afraid of the judgment that he gets from other people and would prefer to just spend his time on YouTube and Reddit, cruising the internet, looking at memes, and something just to take his mind off how he's feeling. He's lost about 8 kilos in the last year or so, and it's mostly because his appetite just really isn't what it used to be. He's not very active, but he's just not eating what he used to, and now he's lost a whole lot of weight. People like James might be struggling by themselves for quite a long time, and it often takes somebody like a friend to sort of kick them out of the way that they're feeling, or at least start them on the path to feeling better. And the most common place that most people go to start with is their doctor, their GP, and to try to get a recommendation about what they should do. Now, it's quite common for people with depression or anxiety or even alcohol abuse disorders to get medication. In this case, he might get antidepressants for how he's feeling. And it's also quite common for a lot of people who are struggling to take antidepressants and then not get a whole lot better. And they might get stuck in this cycle. And what we're going to talk about today then is how do we best help people get out of a cycle where they might talk to a friend, they might talk to a doctor, they might take antidepressants, but they're not really getting that much better. Well, people will often say that if exercise could be packaged as a pill, it'd be the single most widely prescribed and beneficial medicine in the nation. You all know the physical benefits, you all know the mental health benefits of exercise, and it is an amazing treatment considering that it's free for a lot of people or it's low cost compared to other things. Yet one kind of depressing statistic when it comes to being an exercise physiologist is that only 1% of people who are at risk for any chronic health condition are actually referred to EPs in Australia. So let's talk about what's going on today. What we're going to learn is about mental illness, why it's such an important area to look at, and we'll talk about how it's the biggest source of disability worldwide. We'll talk about what some of the common and best practice protocols are for treating mental illness and how the exercise can factor into that treatment. We'll also talk about what an EP does in that system, what it does in the best case scenario, and maybe what the current practice is, and then how you as EPs can have a bigger impact on trying to help manage mental health problems.